We're going through hormones tonight. We're going to go through all of our New Medicine Foundation slides, of which there are many, and create an entire series. And I'm very excited to be doing this. There's great information here, and everybody really needs to know this because there's so much misinformation, which is leading to mistreatment out there, and we need to spread the word. We took 20 or 30 minutes last week and went through this pyramid. I updated it a bit, got the thyroid back in there, and to review this really briefly, there's a lot of hormones in the body that we look at. We consider the foundational ones to be the most important because they're deficient first and now at birth, and we go on up to the hypothalamus and pituitary. We can have deficiencies all across the way. To get into the specifics now, and excesses, if we have hormonal imbalances, to get into the specifics, we touched on these slides real briefly last week. There are 3 main hormones in excess in the body. Now, we're full of toxins. The primary problem here is toxicity, and the increasing toxicities in our world, and how that is just really wreaking havoc and waging war on our bodies. And our bodies are responding, and they're not happy, and what's happening is we're developing illness, both mentally, physically, epidemically. Now, some of these toxins are hormones themselves. Some other excesses in the body are from a result of other parts of our toxic lifestyle. The big 3, and sometimes I refer to this as the healthcare lie, is the L of leptin, the E of estrogen, and the I of insulin, L-I-E. Now, estrogen may be just the most toxic thing out there and one of the most misinformed. There are so many sources now of excess estrogen in our world. Not only do we now use it in almost every animal that we raise as livestock for food and consumption, but we also use it as a mainstay in our traditional allopathic medical system, and so many women are treated with estrogen. And on top of that, a third source is a lot of what we call xenoestrogens. These are chemicals out there that aren't estrogen, but they act like estrogen. So we're just bombarded from all these different directions of excess estrogen. And estrogen in excess is not a good thing. Estrogen causes inflammation, cancer, weight gain, water retention, irritability, both mentally and physically. It really contributes to all of the things that are bothering us, both mentally and physically. Not only that, but our species likes to use synthetic estrogens. So we don't use natural bioidentical estrogen in these animals, in these cows and chickens, and in the medications we take and prescribe all different kinds of women at all different stages in life. We use synthetic estrogens, estrogens that are not natural. And because they're not natural, they are actually more toxic, more carcinogenic, more inflammatory, and more difficult to get rid of. So estrogen is a problem. And over, we are going to be confronted by women that say, well, I'm on estrogen, and I've read books out there that estrogen's good for you, and I need it, and I can't not take it. Well, estrogen can be addictive. All of these, in a way, are addictive, and I'll explain that a little bit more. The more of these hormones we get in our body, the more we need to stay feeling normal. And what happens is we become resistant to the feel-good effects of these hormones. We have receptors for these hormones, all of them, estrogen, leptin, and insulin. We have receptors in our neurological system that receive these chemicals. And as the chemical levels go higher and higher, our receptors do something that's called down-regulate. The number of receptors becomes less and less and less because our body says, well, geez, there's so much of these chemicals out there. We don't need many receptors because the chemicals are going to be hooking onto every receptor we have. So as those receptors down-regulate, we become resistant, and you need more and more of that chemical to have the same effect. This happens with estrogen, this happens with leptin, and this happens with insulin. Now, as far as estrogen goes, women and men, but specifically talking about women, as they get placed on more and more estrogen, they feel the need for more and more. It's very addictive, and it's hard to reduce the levels. When they reduce the levels, they have more symptoms of discomfort and hot flashes and things like that. The primary problem is actually that there's too much estrogen and not enough of the balancing hormone progesterone, and we'll talk more about that. But doctors are really doing the wrong thing by placing women on more and more estrogen. When the problem is estrogen excess, We have to detoxify and stop exposing ourselves to all of this estrogen that's coming through the inorganic foods and through the medications and through all of the xenoestrogens in our lifestyle, which these xenoestrogens are soy products and petrochemicals and fertilizers and pesticides. A lot of these can act like estrogens, and we have to remove these estrogens and then balance with progesterone. So there is a process to getting a woman who is on estrogen off. You have to detoxify her and educate her and balance the progesterone at the same time. But that's a big misconception out there is, well, hey, I feel good on estrogen, and if I stop taking it, I don't feel really good. And what we say is, well, hey, if you're addicted to alcohol, or if you're addicted to some other kind of, if you're addicted to sugar, or if you're addicted to MSG or fast foods for some reason, it feels good to keep taking more and more, and it does not feel good to withdraw or come clean off that chemical. But what medicine does is just give you more and more of those chemicals. If you've got someone who is on pain medication and they can't get off the pain medication, well, doctors are really good at giving the patient more pain medication. They're really good at giving women more and more estrogen. And the way we learned this through the years was women coming to me on bioidentical estrogen. So that's great that they're using bioidenticals instead of synthetics, but they still couldn't get off the estrogen and were gaining weight and were having more hot flashes and on more and more estrogen. So estrogen dominance is the problem. That's a whole lot of information on just one chemical that's in excess in the body, but it's a very, very important one that we need to get through to the women out there especially, but everybody, because we are all estrogen dominant. It's in every piece of meat we eat that's not organic or grass-fed. It's in so many of our products. And now we have so many young women on birth control pills and so many older women on menopausal estrogen medications, again, whether they're synthetic Premarin or bioidentical. Too much estrogen. And we'll go through leptin really quick. Leptin is a hunger hormone that tells us when to stop eating. And as we get heavier and heavier, our fat cells grow and produce more leptin, and we get that leptin resistance, and the receptors downregulate, and we need more and more leptin to have the same response. And what happens is this hunger response mechanism stops working. So in effect, leptin is a hunger or a fat or a weight hormone. And as we get heavier, it increases, and we get hungrier. And you have to break the cycle. And with high leptin levels that we test in labs, it's very easy to test what is your leptin level when you are not eating. If it's very, very high, we're talking 20, 40, 60, 80 or higher, you are very, very hungry. And you have to break through that. And that's what our detoxification protocol does very quickly. And we document that with after labs that show the leptin level very, very low. Insulin is one we know much more about, related to diabetes. And diabetes, for the most part, type 2 diabetes, which is the most common, is a disease of too much insulin. And when diabetics become insulin dependent, they are really circling the drain, unfortunately. They are on life support. Insulin is fueling the fire. It's like pouring gasoline on the fire. It's putting the flames out for a short time, and it's lowering the blood sugar for a short time, but it's making the body even more insulin resistant. Now, insulin, when we test insulin, we see diabetes coming from decades away. Fasting insulin levels don't become diabetic overnight. They climb through the years. And by checking these levels, we can see how pre-diabetic somebody is and reverse this. And we have to reverse it. Insulin really fuels the fire of illness. It is also, like estrogen, inflammatory, carcinogenic, promotes weight gain and fat gain and water retention. We don't know those things about leptin yet, but we certainly would imagine that's probably true. So these three are in excess, and they have to be removed quickly and effectively and in a way with a protocol where patients feel good. And that's what we do with our new medicine treatments, is we remove them quickly and people feel good while they're doing it. Moving on, the most important deficiencies out there. As the pyramid suggested, the androgens are the most deficient. They are the lowest, the foundational level on the pyramid. They also are the lowest produced in our body. They are primarily progesterone in women and testosterone in men, but we do have all in all bodies. They are deficient at birth because of the incredibly high levels of toxins that are neuroendocrine disruptors and basically shut down our glands' ability to produce these hormones even before birth now. Medications do this. Petrochemicals, fertilizers, agricultural chemicals, household chemicals do this. Narcotics do this. So the more toxic we live, the more toxic a birth process, a pregnancy is, the more deficient these will be even at birth. And everyone is deficient in these hormones until proven otherwise. They're very important hormones. They are relaxing. They balance the estrogen levels. They are very important for healthy heart, brain, skin, immune system, HDL levels, you name it. And again, there's many misconceptions out there. Menopausal women don't need less progesterone, they need more. If a woman's had a hysterectomy and a doctor tells them, well, your uterus is gone, you don't need progesterone, they're completely wrong. They need more progesterone and less estrogen. And men need progesterone too. Men need testosterone, and testosterone is not an aggressive hormone for men. When you give a man natural testosterone, they get much more relaxed. And again, men also need blended progesterone for their prostate as well. So there's a lot of information that of how good these are, and they need to be replaced in almost everybody today. The next level up was the adrenal glands, and adrenal glands produce a lot of important hormones. Dihydrotestosterone, which is a precursor hormone, cortisol, which controls blood sugar and energy and clear thinking, and another one not listed is aldosterone, which controls salt levels. The adrenal glands are also the quarterback of the body. They are the stress gland, the fight or flight gland. When we get excited or scared, they boost our cortisol output, and we get a rush of blood sugar, and we can go outrun a lava flow or jump for joy. They're attacked from every direction, and we are overstressed, and everybody has some degree of adrenal fatigue. The androgen deficiencies that come primarily make the adrenal fatigue worse, as the adrenal glands can also produce these hormones and try to, as the gonads are not doing this, so it just more quickly wears them out. So adrenal fatigue is a very important part of our evaluation as well, and we help boost all of these levels. And we actually use bioidentical cortisol in many people, and that is another hormone which is completely misunderstood out there as we listen to cortisol being named the fat hormone. It is deficient in many people. Thyroid hormones are deficient in many people. We know this to be true. We know there's a lot of talk about subclinical thyroid, where people might think their thyroid is low, but their doctors test it and it looks quote unquote normal, and they don't replace it, and they don't know how to replace it to optimal levels. It's very important to replace thyroid if needed to optimal levels with bioidentical, of course, staying away from the synthetics and the synthroids and the levothyroxines. We use bioidentical, which is a naturally blended glandular. Very important for all aspects of health: metabolism, weight control, energy, hair, skin, and nails. Thyroid can improve naturally. When we detoxify people and increase the metabolism naturally, thyroid might increase about 50%. So it's a hormone that we might retest before we replace and see if it's improved, and often it does. And growth hormone is one of the later hormones to become deficient. Up in the brainstem and the pituitary gland, and it is very resilient. It can come back very, very quickly with reduced insulin levels and improved health. However, if it is deficient and needs to be replaced, it's absolutely should be done. Now, how do we test for these hormone levels? Well, we do standard blood labs, just like any physician, but looking at a lot of different hormonal levels. We like to look at total estrogen level in the blood work, because it seems to indicate total load of all of the chemicals. We might see lower natural levels in saliva, but see a higher total level in the blood, suggesting that they have a lot of toxic type estrogens in the blood. They seem to cross-react. So we compare all of these tests. We look at insulin in blood work, thyroid hormones in blood work, and growth hormone in blood work, which the marker there is insulin growth factor 1. So these are all more accurate in blood. And again, fasting insulin, extremely important. That's the most powerful sugar hormone. We'll do a talk on diabetes and talk about how improperly it's tested for in the traditional world, and how we test for it very thoroughly, and again can see sugar imbalances coming from years and decades away. We also looked at leptin in the blood work. We also do check testosterone and prostate levels in blood, because we like to compare with the saliva, and progesterone and DHEA. Now, these testosterone, progesterone, and DHEA are more accurate in saliva, much more accurate, but it's interesting for us to compare and contrast the blood and saliva and show that most often these levels may look okay in blood work and be very, very low in saliva. And we're trying to teach there that saliva is more like the storage tank of these hormones and more like the cell fluid. Blood work is more like the fuel line. The fuel line is going to carry gas until our fuel tank is nearly empty. So you need to look inside the fuel tank, the storage tank, the cellular fluid, to see what the true storage level of these hormones are. And here is why we look at saliva testing. It is, as we were saying, more accurate for these hormones. It more accurately represents the natural storage levels. It's more like cell fluid, and blood is the transport fluid. And we also look with our saliva test at LH, which is went too far there. We'll go back. LH, which is luteinizing hormone, and FSH, which is follicular stimulating hormone. Lots of fancy words here, but basically LH and FSH come out of the pituitary and tell the body that they need more of these certain hormones. So if LH is high and FSH are high, it tells us that the brain is confirming that the androgen levels or the DHT and estrogen levels are too low. Typically we see LH being high and FSH being okay. Dihydrotestosterone, DHT, is somewhat similar to estrogen. It does a lot of bad things in the male body in excess. Prostate problems, just like estrogen grows the uterus, and estrogen also grows the prostate. Dihydrotestosterone can grow a prostate as well. An important point that we'll get to as to why you can't simply replace a man's testosterone with a synthetic injectable testosterone only. It will convert to dihydrotestosterone and put his prostate at even higher risk of problems, which prostate problems we know are epidemics, just like uterine problems. So why do we replace? We've had a lot of great questions already about this. I would call it the far left of natural medicine. The naturalists say, well, you shouldn't replace any hormones because you're just going to shut the glands down and tell the body the gland doesn't have to work anymore. Unfortunately, these hormones are extremely deficient, and we need to replace them. If you have low thyroid, if you have low testosterone, progesterone, low growth hormone, and your body cannot produce it, then you need to replace it. Now, you don't want to over-replace it, and that's where there is truth to this argument, and we say we don't want to be anti-aging. We don't want to give the body more than it should. We don't want to just put in tons and tons of testosterone and growth hormone, which is really what anti-aging does. They say, well, if you're 80, let's give you the hormone levels of a 20-year-old. Now, that will shut your natural production down. Your body will say, heck, we don't need to produce any. But we can't let the problems continue. We can't let the severe deficiencies not be corrected. We have to give the body what it needs. And just like with thyroid, thyroid may improve naturally. Some of these hormone levels we'll see come back. We'll see growth hormones come back in a lot of people. We'll see thyroids improve significantly. And then we reevaluate and say, well, how much do we still need to replace? The severe deficiencies, the androgens and a lot of adrenal problems, are severe and epidemic and a huge part of illness. So those do need to be replaced appropriately. But again, we're always going to do them at appropriate levels for each individual at their point in life and their documented deficiencies in their testing and their symptoms. So as always, beware of the media. Cortisol is not the enemy. If you see it in the media, it's most likely not true. And we're going to promote the truth here. This is typically what we prescribe. We use our branded Pure Cell label, which means it's coming from a pharmacy that you can trust and it's being balanced in its production. This is Johnny's not a real person here. But this is a typical looking prescription where a man is going to get a certain amount of testosterone, a certain amount of progesterone, and a certain amount of DHEA, which are all very important to provide him a balanced hormone picture. And progesterone in a man is not a very well-known fact, but very important for prostate health. It actually blocks the conversion of testosterone to excessive dihydrotestosterone, so it really protects the prostate in a number of different ways. And this is what we hope people to be getting, because 9 times out of 10, when people come to us on other pharmacy or physician prescribed hormones, unfortunately, balancing bioidentical hormones is not nearly a perfected art, and most of what is being done out there is unfortunately incorrect. Getting into a little bit of the specifics of male and female, and we'll see how we're doing on time after that. Typically, males have the same high estrogen problem. It's in all of us now. And our androgen deficiency is low testosterone. And that does not feel good. Basically, our body's chemistry is telling us to look more like a woman than a man. And that's an obvious reason why we have some of the physiological changes, the physical changes that we're seeing in men and even young boys, and mentally. It does not feel good. It sets us up for a very inflammatory, irritable state, with testosterone being a relaxant and estrogen being a stimulatory. It's a humongous, it is the primary problem with most mental health issues out there in men, is this hormonal imbalance. You can add in other hormone deficiencies like thyroid and growth hormone, and it only makes you feel mentally and physically worse. So what does this hormonal imbalance tell the body to do? Well, estrogen causes weight gain, testosterone causes lean muscle. So we're getting 2 signals to have weight gain, fat deposition, and an unhealthy and female traits. So you're talking about breast development in men and small male anatomy and putting on weight and fat deposits in more feminine type places. We're seeing this. It's very obvious. We're seeing this in our children now. Not to mention the depressive and the mental fatigue and anxiety and insomnia and irritability issues that are so widespread. And this is a huge one here. HDL, healthy cholesterol levels, are very low. And this is the primary reason right here, low testosterone. And the pharmaceutical industries are clamoring and spending billions of dollars to find a drug that will raise HDL. Well, this will do it right here. Give a man back his missing testosterone, and his HDL usually comes up 5 to 15 points very quickly. There's other reasons about HDL too, and we talk about healthy fats and exercise as well, but hugely important for cholesterol and cardiovascular risk features, and here's this, these mental aspects we were talking about. And again, until proven otherwise, any man that feels any of these things or is experiencing any of these things, this is a great place to start. Replace these missing hormones, detoxify and educate him as to getting these estrogen levels down. And very, very simply, you feel more like a man, and that's a good thing. What other things do these contribute to? Well, prostate illnesses, cancer risks, inflammatory problems, immune problems, muscle problems, poor health in general. This imbalance is a tremendous part of why men are getting sick mentally and physically. Estrogen is a carcinogen. The synthetics are inflammatory. Our low testosterone levels contribute to it. This ratio, I cannot tell you how important this ratio is in men to correct and how easy it is to correct. Not to mention some very, very poorly known facts about the prostate and the epidemics of prostate problems. You know, it's not just because men are living longer. Our prostates should not be killing us, no matter how old we are. Prostates and uterus glands are the same, come from the same origin. And so they both respond to these hormonal states of hormonal imbalance. Estrogen grows a prostate, grows a uterus. Testosterone and the female counterpart progesterone maintain healthy tissue, healthy prostate and uterus tissue. Not to mention that low progesterone in a man contributes to higher dihydrotestosterone levels, which also grows the prostate and contributes to hair loss as well. So we have high estrogen levels growing these prostate and uterus glands. We have low testosterone and progesterone that are not able to maintain healthy tissue, so what do you get? You get really big, unhealthy glands. And what happens? We cut out the uterus, we cut out the prostate, and we do nothing to fix the underlying hormonal imbalance which is causing these problems. In fact, in women, we give them more estrogen, and we don't give them progesterone. We tell them, well, your uterus is gone, you don't need more progesterone, let's just give you some more estrogen because you're menopausal. And that makes the entire body worse because the entire body reacts to these hormones, not just these glands here. So we're really treating people incorrectly. And now after, as is common with medicine, after 20 or 30 years, we see that maybe what we've been doing really isn't right. Maybe we should have been cutting out every man's prostate and every woman's uterus. Maybe that doesn't make you any healthier. And that's what we're finding. Similarly with the antidepressants, we're finding that they're dangerous and there might be another problem. And the problem is the hormonal imbalance. It's not a neurotransmitter problem. A quick look at labs. We won't dig into this too far until we get maybe some physician interest. These are great hormone tests. They're very easy to get. They're basically one tube of saliva, and they take about 2 weeks to get back. And you see a beautiful, really biochemical picture here of what's going on. This is a typical looking man where his testosterone may look okay. It's kind of within range, but getting towards the middle, lower end. But if you look here, the androstenedione is high. The DHEA is producing this testosterone, and his body is saying, yeah, in fact, the LH is high. We think the testosterone should be actually higher because we know it's not coming from the testes, it's coming from the adrenal glands. This is a stage 1 deficiency where everything still looks okay except for this because the adrenals are covering the deficiency. But this will just wear the adrenal glands out eventually. But this is what we look at in everybody, and we decide what they need. We typically give them a good healthy balance of testosterone, some adrenal support of DHEA, depending on how deficient their adrenals are, and some progesterone, if necessary, to help keep dihydrotestosterone low. Again, the pituitary hormones confirm all of this. And we'll go through these stages, and then maybe we'll call it a night before we get to the female hormones. So that was a stage 1 deficiency. DHEA looks okay. The androstenedione is elevated, showing an adrenal response, an adrenal coverage of the testosterone levels, but the testosterone still looks okay. And the DHT is normal. Here, you're not going to have any symptoms, really. You're going to have a man that still feels fine because his testosterone levels are really okay. It's just his adrenal glands that are doing most of the work. So it's the early stages. In stage 2, testosterone level starts to drop more significantly. DHEA is dropping. Dihydrotestosterone is dropping a little bit. Actually, here, body still thinks everything looks okay, but to me, this is showing that the adrenals are starting to wear out a little bit. The androstenedione isn't super high, but the testosterone is getting lower, and we're just slipping into stage 2. Really, erectile dysfunction is a lot of hormonal imbalance issues, but even more so, it is neurological and cardiovascular problems, and that's concerning because when you go in with a medication such as Viagra or Cialis or any of these erectile dysfunction medications, you are artificially changing blood flow to maintain that erectile function. What the problem is there's cardiovascular problems in the blood flow of that organ, and there are neurological problems as well. So to artificially clamp down certain vessels to maintain the erection, that's why there are such significant cardiovascular side effect problems, and why anybody with known heart disease can have problems. Well, 85% of us are developing heart disease, so if you start changing the cardiovascular function of the whole body, you're not just affecting that organ, you're affecting the whole body. It's very dangerous. So any man that comes to me that has erectile dysfunction, we very quickly say, well, we need to look at your health in total. Yes, hormonal balance is very important, and you need to have balanced hormones of all levels to feel sexually functionable. But even more importantly, we're looking at cardiovascular, inflammatory markers in these people, insulin markers, anything that could lead to cardiovascular problems. I'm much more concerned about their heart and their cardiovascular system than just their erectile dysfunction. We're going to balance hormones, but we've got to look and see what's going on in their cardiovascular system because they're almost certainly developing heart disease. Makes the medications on anybody very, very significant. Now, when you replace, to answer this other question, when you replace the progesterone and the testosterone, you replace the androgens in either men or women, you help relieve the stress of that deficiency on the adrenal glands. So the adrenals do improve significantly just from that. We also usually add in some DHEA to boost the adrenal levels, and that relieves, again, that adrenal gland's added job of producing the androgens that aren't being produced by the gonads. So this first step of restoring adrenal health is to restore these primary deficiencies. Well, let's see how long we have and how many slides we have for female. We don't have that many. So let's go through the females really quickly here. I think we've got 5 or 10 more minutes for this stage. It's a lot of the same story in women, thinking along the lines of estrogen and androgen. Again, it's high estrogen and low androgen, but in women the primary androgen is progesterone. They again have weight gain problems, depressive problems, HDL problems, excessive feminine traits with the high estrogen. So we're seeing young female development in 6 and 8-year-olds. We're seeing excessive weight gain and breast development and weight gain on the hips. We're seeing large uteruses, of course, and fibroids and heavy bleeding and severe cycle and menopausal problems because we have these very, very high estrogen levels and low progesterone levels. So again, we need to reduce the estrogen and we need to replace the progesterone, and that's exactly the opposite of what's being done. They're given birth control pills which are more synthetic estrogen and then synthetic progesterone, which actually lowers the amount of natural progesterone even more so. Or sometimes we have women get just only synthetic progesterone. They get the Depo-Provera injection. And what that does is it lowers the natural progesterone levels to 0. And typically this makes women feel absolutely horrible. All of these anxiety, insomnia, stress, and aggression problems get much, much worse. So again, just the wrong way to treat. What we need to do is reduce the estrogen, detoxify it, and educate on where it's coming from, get women off of these synthetic estrogen medications. Again, that's a process. It's a detoxification and somewhat of a withdrawal process. If they are taking bioidenticals, and there are a small percentage of women that may need a little bit of bioidentical estrogen, you want to use the lowest dose possible. So you first want to detoxify it, get them through that estrogen addiction withdrawal phase, get them as balanced as you can. It's going to take at least 6 weeks of detoxification for these women that have been on estrogen a long time. And replace the progesterone that's missing, especially if they've had a hysterectomy, especially if they've had any kind of reproductive surgery. And to make a quick point there, any reproductive surgery, even tubal ligations or vasectomies in men, especially prostate surgeries and uterus surgeries, cut very vital nerve and artery functions to our glands, whether the ovaries or testes are removed or not. It effectively turns off these glands, and the progesterone and testosterone, the androgen deficiencies, get much, much worse. So a key part of our health history is if any women or men have had any of these reproductive surgeries, just a vasectomy, just a tubal ligation. While they're great for birth control, and I would recommend them, I've had one myself, and I think it's very, very effective and good for family planning. You have to know that it's going to exacerbate these problems. However, we are already deficient in these hormones, so it doesn't change much from a treatment perspective, except that we know you need to have some hormonal replacement, and it's probably going to be severe. The estrogen-progesterone imbalances in women, of course, lead to big uteruses, ovarian problems, early menarche, so we've got these early puberty issues. We've got premenstrual monthly cycle problems because the estrogen grows a very, very thick lining of the uterus. The low progesterone makes it very difficult to maintain the health of it, and you have very, very heavy periods with a lot of cramping, a lot of mental swings, and bloating and swelling. That's what estrogen does, and especially in lack of progesterone. Same thing happens in menopause. Estrogen and progesterone levels should be coming down together, but they don't. Estrogen stays high because of the toxicity, and progesterone does get lower, and then the adrenals come into play and get severe. So menopause is very imbalanced and needs to be balanced. We have to bring the estrogen level down and replace the progesterone. And again, in most medical practices, women are just the opposite is done. They're given more estrogen. If they're given progesterone, it's usually synthetic, which again makes the progesterone levels worse. So we've just really mistreated women and men over the years as far as these hormonal issues. Contributes, of course, to cancer risks. Cancer is epidemic. It's getting worse. This hormonal problem is a huge part of it. Until we start talking about this in the mainstream, we're going to continue seeing more and more cancer of all kinds. We're not doing a darn thing to reduce any of these cancer risks, and not just hormone-related cancers like breast cancer or ovarian, uterine cancer, prostate cancer. This relates to all cancers: liver cancer, kidney cancer, pancreatic cancer, skin cancer, brain cancer. This is cancer of all kinds. Androgens, of course, are good for muscle health. This balance is very, very important for inflammation and immune system